produce an abnormal amount, an excess amount of new cells. But pancreatic cancer in particular, it's quite a deadly cancer. In the US, it is the 11th most common cancer, but it is the 3rd most deadly. And this is due to the difficulty associated with diagnosing or catching pancreatic cancer in the early stages. Many cases of pancreatic cancer are actually only diagnosed in stage 4. And that is when the cancer has metastasized or spread to other organs in the body, making the cancer that much more difficult to remove and treat. So first things first, what is the pancreas? So if you know about diabetes, you know about the pancreas. So the pancreas is a gland located deep in the abdomen between the stomach and the spleen. It makes enzymes to help digestions and hormones that control blood sugar. So it is a very important organ in the body. What is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. Food is broken down into sugar, which is glucose, and this goes into the bloodstream. The pancreas secretes insulin, and the insulin helps your cells to use glucose as energy. But with diabetes, you would have, there would be one of two things. You would either have insufficient or no insulin being produced, or your body cannot use insulin well. And so it leads to a buildup of glucose in the body, in the blood, which is not a good thing. So what is pancreatic cancer? As I mentioned, in the US, it's the 11th most common cancer, but the 3rd most deadly due to the difficulty of diagnosing this cancer in the early stages. It's an abnormal cell growth in the pancreas. And as with most cancers, it's normally cells divide to form new cells as needed. But with cancer, sometimes this process does not work well because either extra cells are formed when they are not needed, or the old cells do not die. And this leads to excess cells and a massive tissue called a tumor. So I think you may have heard of before that a tumor, they are usually classified into 2 types, one being a benign tumor or a malignant tumor. So a benign tumor is an abnormal mass, but it cannot invade other parts of the body, whereas a malignant tumor is what is called cancer. These are cells that grow out of control and spread to other tissues and organs. So how they define pancreatic cancer, even if it has spread to other parts of the body, if it started in the pancreas, that is when they would classify it as pancreatic cancer. So what are some of the causes of pancreatic cancer? Well, there are several, but let's just have a look at a couple. There's changes in DNA, possible genetic or environmental factors. The exact cause is not well understood, and most is random or caused by smoking, obesity, and age. So what are some risk factors, or what are some things that might put you at a higher risk of developing pancreatic cancer? So let's go through them. Some of it is long-standing diabetes, chronic and hereditary pancreatitis, which is chronic inflammation of your pancreas, smoking. If you're over the age of 60, depends on your gender, males do have a slightly higher risk of developing pancreatic cancer compared to women. If you have a diet high in red and processed meats, and obesity. So as I mentioned earlier, pancreatic cancer is difficult to diagnose in the early stages because it is difficult to find with most common diagnostic tests. So, and why is this? This is because a pancreas is located deep in the abdomen, and this usually cannot be seen during a normal physical exam. Symptoms are not always obvious, and there is no standard test for pancreatic cancer, and as such, we often don't find pancreatic cancer until it has progressed to the much later stages. And as we go through these symptoms, you will notice that these symptoms are very general, and they could actually point to other diseases or other cancers. So usually, unless you're looking for pancreatic cancer, it's difficult to find. So symptoms, most are vague, unexplained symptoms. So things like pain, usually in the abdomen or back, weight loss, jaundice, which is when your skin becomes yellow. Your skin or the whites of your eyes become yellow, loss of appetite, nausea, changes in your stool, pancreatitis, recent onset diabetes, fatigue, weakness, and depression. And if you're in the later stages of pancreatic cancer, fluid in the abdomen and blood clots. So, how can they actually diagnose pancreatic cancer if your doctor has a suspicion? This can only be done through an imaging study. So you would need certain very specific machines that can scan your body. So things like CT scans, MRI, or an endoscopic ultrasound. And the doctors do require a biopsy or a sample of the tumor to exactly diagnose the type of cancer. And what is the link between pancreatic cancer and diabetes, other than having diabetes being a risk factor? So, according to Suresh Chari, MD of the Pancreatic Cancer, PanCan Early Detection Initiative from California, USA, new onset diabetes is thought to be an early symptom of pancreatic cancer because, obviously, as we mentioned before, the pancreas is involved with producing hormones, i.e. insulin, which control the blood sugar in your blood, control your blood sugar, right? So if you have pancreatic cancer, this is going to impair the pancreas's ability to do its job to produce insulin, and resulting in some people with new onset diabetes. So other links between diabetes and pancreatic cancer include the length of diabetes. As I mentioned, long-standing diabetes increases the risk of pancreatic cancer by 1.5 to 2 times. Symptoms, Oh, yes, I did that. And why is this research into the link between pancreatic cancer and new onset diabetes important? This is because early detection of diabetes and pancreatic cancer could dramatically benefit the patient, as early detection increases the chances of recovery from pancreatic cancer. And the Early Detection Initiative is researching whether abdominal imaging tests at the time of a diabetes diagnosis can lead to an earlier detection of pancreatic cancer, or when the cancer can be surgically removed. So the possible before I go into that, sorry. So there is the concern of unnecessary testing, because you could just have type 2 diabetes instead of diabetes caused by pancreatic cancer. So let's look at some possible differentiations between type 2 diabetes and new onset diabetes caused by pancreatic cancer. The first one is that patients tend to be older, their blood sugar levels rise more rapidly, and with type 2, normally people gain weight and then develop diabetes, in comparison to if you have cancer. Sometimes you would just lose weight. And yes, with new onset diabetes may experience unexpected weight loss. So, in conclusion, pancreatic cancer is one of the most deadly cancers due to its difficulty to detect it until its later stages, when it has spread to the rest of the body. Knowing when to order an abdominal examination to reduce follow-up procedures, anxiety, and overdiagnosis, which is when a patient is diagnosed with new onset diabetes, could help detect pancreatic cancer at its earliest stages. And this research is still ongoing, along with research for blood tests to actually detect pancreatic cancer. So that is all for today. Thank you so much for listening. I hope we all learned a little bit more about a cancer that I don't feel has very much awareness, but it is very deadly, as with most cancers. But this one is one that, even though it is the 3rd most deadly cancer in the US, I feel that not many people actually know about it. People know about breast cancer, prostate cancer, but not that humble organ that